This is critical thinking on cardiovascular physiology, and let's look at the questions. The first one is on valves and has to do with the cardiac cycle. Second question is a clinical question on, again, related to cardiac cycle. This has to do with systole and diastole and hence cardiac output. Here a more direct question on cardiac output. And then the last one is on blood pressure. Now let me go back and tell you the correct answers and how you should be thinking. So this one is on asks you when the semilunar valves, which are the aortic and pulmonary valves, when they will close. And the correct answer is the third one, which is at the end of ventricular systole. Now, if you look and see why this is the right answer, and let's just take the ventricles. So here are the ventricles, and from the right ventricle, you have the pulmonary artery coming out. From the left ventricle, you have the aorta coming out. So when the ventricles contract, they push blood into the aortic and into the pulmonary and the aortic valves. So when they contract, which is ventricular systole, these valves have to be open. Hence, obviously, at the beginning of ventricular systole, these valves will be open. They will not close. So that is not the correct answer. Now, the second choice, which is at the end of ventricular diastole, there is no point in these valves closing after the ventricles fill with blood. So let's say the blood has come from the atria into the ventricles, and now the ventricles have finished relaxing, which is the end of ventricular diastole. At this point, now the ventricles will begin to contract, so systole will start. So there's no point in these valves closing at that point, which is at the end of ventricular diastole, because they have to open really, which is when the systole begins. They will close at the end of ventricular systole, or the other way we could also say at the beginning of ventricular diastole, not at the end of ventricular diastole. So therefore, this is not the right answer either. So the correct answer is when their job is done. That means when the ventricle has contracted, it's pushed its blood into these arteries, and then now it's beginning to relax, which means that contraction has ended. So that is at the end of ventricular systole is when these valves will close. Let's look at the next one is, what happens when there is severe tricuspid stenosis? Will it result in right-sided heart failure? And the correct answer is yes, true. Because again, if you look at the heart, and this is the interatrial interventricular septum, here's the tricuspid valve, the mitral valve, the pulmonary here, and the aortic. Now, suppose there is stenosis of the tricuspid valve, so it is really narrowed. What will happen? Blood cannot go from the right atrium into the right ventricle. So, therefore, the right atrium, which receives the superior vena cava and the inferior vena cava, what will happen? Since blood from these cannot go into the right atrium, it will actually back up into these veins. When it backs up into these veins, in the superior vena cava, you will end up with engorged neck veins because those veins cannot drain, engorged neck veins. And inferior vena cava, if the blood in the inferior vena cava is backed up, it is bringing blood from the lower part of the body, from all the organs in the abdominal cavity. So what will happen is that you will have the liver will be enlarged because blood from the liver cannot go into the inferior vena cava, it cannot drain into that. So there is engorged liver, so the liver is enlarged, engorgement of the liver, it feels tender. The blood from the limbs, the lower limbs cannot go up, so then you get edema in the lower limbs, or what is known as pedal edema. So all of this you can see is on the right side, so there's a problem on the right side. So yes, it will cause right-sided heart failure. So whenever there's a valvular problem on the right side, if it is tricuspid or if it is even pulmonary stenosis. So imagine if the question had said pulmonary stenosis, the same thing would happen. Blood comes into the ventricle, but it now can't go through the pulmonary valve into the pulmonary artery. So what will happen? The ventricle will first have a fill up with blood. I mean, it cannot be passed out, so the ventricle would not be able to empty properly. So the blood will then backtrack, which means that the atrium cannot pour all its blood out into the ventricle because it's already full, which means it'll go back in the same way. So any problem in the valves on the right side will cause right-sided heart failure. Any problem with the valves on the left side and stenosis will cause left-sided heart failure. So that's how you have to work out this question. Let's look at the next one, which says increasing the length of ventricular diastole. So systole is a more fixed time. Diastole, on the other hand, can change. So what happens if you increase the length of ventricular diastole? That means the ventricles are able to relax for a longer period of time. If they relax for a longer period of time, it will help in coronary artery filling. Why? Because the coronary arteries fill during ventricular diastole. So if the length is longer, that means they'll be able to fill better. Next one, it'll increase stroke volume. Yes, it'll do this too. And why is that? Because if the ventricles are allowed to relax for a longer time, that means they will fill better. And if they fill better, more blood will be in the ventricle, which means the end diastolic volume will increase. So the end diastolic volume will increase. So if the blood inside the ventricles is more, it's naturally going to be able to push out more blood, which means the stroke volume will increase. And actually, this is how athletes maintain their cardiac output. See, cardiac output is heart rate times stroke volume. Now, because of a high vagal tone, the heart rate in athletes is low. Now, if this is low, this has to increase. So the athletes maintain their cardiac output by having a very high stroke volume. And the reason for that is if the heart rate is low, that means the ventricles can relax for a longer time, fill with more blood. If they fill with more blood, they can push out more blood per beat, which means they can increase their stroke volume. Next one, would increasing the length of ventricular diastole increase the contractility of the ventricles? Yes, it will do this too. And why? The reason is the same. If the length is increased, more blood will fill in the ventricles and the end diastolic volume will be more. If the end diastolic volume is more, that means the ventricles will stretch a little bit more because they are filled with more blood. And remember from ANP1, if there is increased muscular stretch, the contraction is much better. So therefore, since the ventricular wall is stretched, that will improve the contractility of the ventricles. Hence, it will do this too. So therefore, the correct answer is all of the above. So it's all of the above. So that's the correct answer for this question. So you can see how you have to reason out all the choices.